Namaskar friends. This is lecture 2 of module 7 of the stress management course, and this module is devoted to understand the intricacies of our cognition and health conditions in managing the stress in chronic health problems successfully. Till now, we have talked about what chronic stress is and how different psychological factors can contribute in its perception, drawing back to the models proposed by health psychology. In this lecture, we are going to learn more about the physical and psychological mechanisms through which the stress is created, experienced and regulated by individuals who suffer from chronic illness, and we will also talk about the interplay between the physical and psychological mechanisms, including the consequences of these interactions. Let us begin with the discussion of the physical and psychological root of producing stress. Whenever we find ourselves suffering from some kind of ailment, it triggers a particular bodily response, of course, due to that medical condition, and it also triggers a psychological response which is expressed or reflected in two roots. First is the HPA axis, the hypothalamic pituitary adrenal axis. We have learned a lot about it in earlier modules also, but because it is apt to mention these things again in this particular lecture, let us discuss about these things briefly again. The HPA axis usually encompasses the endocrine route through which the body responds to the experience of stress. Our hypothalamus triggers anterior pituitary, which in turn triggers the adrenal gland for the secretion of cortisols and adrenaline. When these two hormones are released in the blood, people experience so many changes in their physiological state, such as increase in the level of blood glucose or increase in blood pressure or negative mood state or extreme fatigue and things like that. Similarly, the anxiety or the stress of the disease can trigger the sympathetic adrenal nervous system route also. So, the sympathetic nervous system gets activated, especially when we come to know about the disease for the first time, and it can remain active for the first few days unless we actually mentally accepts the fact that the disease has already come, we are caught in it, but there are ways to get out of it or at least to manage it successfully. Unless this happens, the moment we get to know that we have developed a new disease which is chronic in nature and difficult to manage, we suddenly find ourselves in a state of extreme stress, which is reflected by the palpitation, the sweating, the anxiety, the dizziness that you feel in your head. This feeling can continue for a few days unless we settle down with the fact. This happens because of the sympathetic nervous system route, which make significant alterations in the physiological mechanisms of our body. It again increases our blood pressure, it again mobilizes energy to a great extent, leaving the body exhausted. So, these two things can add up to the physical symptoms as well as the perception of stress. When these two things happen and the stress continues for a long time, Another response is suppression of immune system of the body. When the immune system of the body gets suppressed, we become vulnerable for all kind of infections, may it be bacterial, viral or fungal or of any other kind. So, what happens? Along with the main disease, it increases the risk of developing several comorbidities, that is the disease states which are somehow developed due to a main disease condition. So, our stress is not only impairing us from taking proper corrective measures for the treatment and management of the disease, but it also makes us more vulnerable towards development of other diseases and also creates several physiological symptoms like indigestion, like palpitations, like sweating, like fatigue, headache and many more as a result of the activation of HPA axis or SAM axis. So, stress created due to a particular health condition causes further physiological disturbances in the body, and all of these things taken together increases the level of stress experienced by the person many folds. Now, when all this happens, of course, certain psychological factors, cognitive factors, emotional factors become very important in the overall management of this situation. What happens that the first factor which comes into play is our assessment of the situation. What kind of assessment? I was just talking about that the SAM axis, the sympathetic adrenal medulla axis can become active the moment we come to know about the disease, and it can last for a day or two unless the extra anxiety that we are feeling because of this new development with our body subsides. So, why does it happen? Why this stress is generated and why it is subsided? This is all because of our cognitive assessment about the situation. When we feel that we have developed a kind of condition which is going to make significant changes in our body, significant changes in our physiological state, and it may cause significant impairment in our capacities, so that we may not be able to live life such happily as we used to do, or we may not be able to perform our activities with the excellence that we are trying to do or we have been doing so far. This causes extreme anxiety and stress. Then what happens? We try to look about the information of that disease, why this disease happens, how we can manage this disease, what are the possible treatments available for this, what are the pros and cons of those treatments which are available that can be tried. So, we try to get more and more information about the disease and the things related to it. The moment we get enough information and we process it effectively, and most of the time we get to know that this particular disease can be managed effectively, and many people are already suffering from it and they are leading their life happily, successfully, performing all their duties nicely. They are not dependent upon other people. This is another big worry, that now I am going to be dependent on other people, so I am going to lose my independence. I have to live according to other people's guidance or their availability, their convenience. So, taken together, all these anxieties can settle down a little bit or to a significant level if we get appropriate informations regarding the development and the growth of the disease and the possible course of corrective measures. The moment it happens, our reaction or our perception towards the situation changes, and you can find the result of this change in perception. The level of anxiety in the first few days is certainly not equivalent to the level of anxiety that we find later on. So, it gradually settles down as we become more and more capable of managing the things, or our cognitive assessment about our own ability to manage the situation changes with time. Then comes the emotional response, how I am going to respond to the situation, what kind of emotions I am going to feel. Many people find themselves in an extremely anxious state. They cry, they become depressed, and they find as if it is the end of their life. Others may not become so panic. They try to use their logics and past experiences and their experiences with other people to moderate their emotions about their illness, and can remain in a better state to manage the disease conditions. Similarly, when we manipulate our cognition, when we try to change our emotions and we do it successfully, our behavioral responses towards illness and the stress produced by it also changes. For example, if the person is very anxious, he or she may get indulged in some sort of counterproductive behavior, like smoking, like consuming alcohol, or trying to overuse the leisures available in life in view of the fact that the life is too short now, or we do not have much time, so let us enjoy it, let us do everything. So, this thinking in itself is not bad, but if we overdo everything, so extreme of anything, excess of anything is bad. It may cause harm instead of doing something good to the person. Instead of that, if we adopt a more reasonable approach towards it, a more logical attitude towards our health condition, we may exhibit productive ways to counter the disease condition and get our functional level back to normal. So, our behavioral responses mainly changes as a function of how we conceptualize the situation and how much we are able to regulate our emotions which are associated with the condition of disease. Then it is a bidirectional relationship, that is the relationship between the physical factors and the psychological factors is a bidirectional relationship, where the physical changes in the body modifies the psychological assessment of it, modifies the level of anxiety and stress that we feel, increases or decreases the worry regarding the future of the disease, and all these psychological assessments can in turn affect the physical state of the body. So, the changes or the influences flow from both directions, and if one state gets worsened, it is going to worsen the other part also. The reverse is also true. If we can make some positive changes in psychological part of the person, this will soon be reflected in the physical state of the person, which will again send a positive impact to the psychological factors and improve it further. So, instead of entering into a vicious cycle where both psychological and physical elements of an individual are sending negative waves to each other and becomes a cause to worsen the situation, one must try to induce positive changes in the physical and psychological aspect of the person, so that a fresh circle or cycle can be set up, which is improvement oriented, which is growth oriented. Whenever a person gets a physical health problem which is chronic in nature, it always increases the risk of developing comorbidities, means a disease attracts other diseases. For example, if a person becomes obese, it is going to attract a cluster of diseases like diabetes, hypertension, arthritis, cardiovascular problems, and so forth. If a person gets diabetes, again it is going to serve as a trigger point for other kind of problems, may it be retinopathy or problems related with kidneys, related with hearts, and decreased immune capacities or decreased immune capacities of the body. So, one problem attracts the other problem, resulting in several comorbidities. At the same time, the chronic health problem can induce long term mental health problems also, such as burnout, depression, and of course anxiety and worries. Taken together, these two complications result in impaired cognitive function shown by the individual. Sustained stress level can lead to detrimental effects on cognitive functions, specifically on attention, memory, and decision making skills. Sometimes the information processing behavior also gets affected by prolonged level of stress which is present over there. Therefore, we find people becoming more forgetful or inattentive when they have a lot of suffering in their lives. That was all regarding the interconnection of the physical and psychological aspects of individuals. Let us have a quick recap of what we have learned till now. Physical mechanisms of stress can affect the main organ systems of the body. They can also suppress the immune system and increase the inflammations if present. Similarly, the psychological aspect of the disease is also capable of influencing the physiology of the body, increasing the perception of symptoms a lot. So, here is a vicious cycle between the physical and the psychological element, which is quickly set up in an individual who suffers from chronic illness. However, one can induce positive changes in either or both of these elements, that is physical and psychological, and soon they get reflected in the overall state of the individual. So, it is better to make interventions at the level of cognition and emotion, thereby improving the cognitive functions and also the health condition of an individual, because it will increase the likelihood of behaviors which are related with positive health behaviors, which are related to the adherence with the instruction of the doctors. So, it is important to monitor the psychological aspect of a person suffering from chronic illness along with the medical treatment which is prescribed for improving the physiological state. These are the references that you can go through. Some more references for further reading. The list goes on. Thank you very much for your patient listening. Thank you.